Hi, I'm Amanda Ralph. I'm a nurse practitioner and the owner and founder of White Coat Aesthetics here in Las Vegas, Nevada. Okay, today I want to go over what the risks and side effects are of receiving dermal filler treatment. And when I'm talking about dermal filler, I'm going to be talking about hyaluronic acid dermal filler. I'm not going into Sculptra, I'm not going into Radius. I'm talking about hyaluronic acid dermal filler today. First are going to be your very mild side effects, and these are all potential. So it doesn't mean you're always going to get them, but they're definitely a risk and more common. That is going to be bruising. I always say to clients, a needle in the face, there's a potential for bruising. I do everything I can to avoid it, but it is very hard to completely avoid a bruise. So needle in the face means potential bruising. Also swelling. Some areas of the face are going to swell more than others and are going to be more obvious to the swelling. Lips swell very obviously. Cheek and chin, there is absolutely swelling. Sometimes it's hard to see it in the moment. But what you should understand about that is that you're going to want to give it about a week or two before you are judging the results because some swelling is happening. Other potential side effects are going to be redness at the site of injection, pain and tenderness at the site of injection, a potential for like itching or a rash. The rash and the itching is much less more common, but we know that it is a potential side effect. These are all really mild. You can absolutely reach out to your injector if you're concerned with them, but for the most part, you just kind of have to wait it out, leave the area alone, be very sensitive with the skin, and just kind of let the skin heal as it should. Now, there are definitely some more rare and serious risks when it comes to injectables or injectable dermal filler. One of those is going to be an infection. I will say, if you are going to a proper injector, you really should not be seeing an infection. I have never seen an infection in all of my years of injecting. And a lot of that is based on the cleanliness at the time of the injection, making sure that the skin is free of makeup, of any sort of bacterial pathogens, that what we are doing is keeping clean and sterile technique. Another risk of dermal filler related injections would be that of migration. I am sure you guys have heard of this in this space at this point. It really is most common in the lip area, and a lot of this is going to be based on injecting too much, injecting improperly, doing injections too frequently together. With lips, I want you to wait a good amount of time before getting any more so that we can prevent that risk. But we do know that it is a risk. Then the most serious and potentially dangerous risk is going to be that of vascular occlusion. Vascular occlusion, which I know I have discussed in this channel before, and I would love for you to go back and watch that. Vascular occlusion is if dermal filler gets into a blood vessel and then stops the blood from reaching the tissues in that area. So it can be right at the site of injection. It can travel to a different area. This is going to be something that does need to be reversed most of the time. And so you need to communicate with your injector if you believe that you have this in your skin. I always try and give a good little thorough discussion about it in my room so that patients know what to look out for when they call me. But what I would tell you to look out for would be very, very strange discoloration, a white or a black kind of a discoloration, extreme pain to the skin, and potentially this area spreads. It's not just a little bump or a little dot of a bruise, but it is, maybe it started here and now it's getting worse and it's spreading to other areas. You would definitely want to reach out to your injector if you think you have this. And I am, again, very, very quick to be like, let me take a look at this. I usually bring the patient back into my practice because if there is a vascular occlusion, you do want to get on top of that very quickly. I also want to talk about potential long-term related outcomes when it comes to filler risks. Again, very, very rare, but can happen. That's of nodules, granulomas, bumps under the skin, late-term inflammation. So it didn't happen right at the time of injection, but maybe months or weeks or years later, all of a sudden the area is swelling up again. Very, very rare, but we do know that there are documented cases. So again, please keep in communication with your injector. That mostly covers all of the potential risks you're going to see. What I want to have a discussion about: do not let an injector touch you if you wouldn't be comfortable talking to them about a potential bad outcome. You should be going to an injector you trust so that if anything does happen, you feel safe and comfortable going back to them to do that treatment. I would say go with your gut on this one. Have a consultation, have a conversation with your injector. If you get the vibe that they care about outcomes and they care about what an actual risk would be, you can let them touch you. But if you ask them or inquire at all about adverse reactions or risk and they just brush it off or they act like it's nothing or make you feel like you'd be crazy for even asking, I really would not go to that injector because odds are they are not going to be the person to trust when treating you for that bad outcome. And then again, just making sure you're going to someone who's educated, who has all of the things in their office ready to treat in case that there is an adverse event. But ultimately, I just want you to make sure that you are going to someone that you feel safe with, because every single adverse reaction when it comes to an injectable, none of these are life-threatening, and they can be reversed if it is something that is potentially dangerous. So make sure you're going to someone who knows what they're doing. Okay, let me know if you have any other questions or comments about adverse reactions or risks associated with filler. I'm happy to expand on any of these if you want to know any more details. Just let me know in the comments.